Good evening, and thanks for joining me. My name is Brian Penner, and I am the author of Medicare Breakdown. And if you stay till the very end, I'll tell you how exactly to get a copy of this book at no cost to you. But if you're hopping on tonight, you're probably feeling a few things. Number one, you might be confused. And then number two, you've probably been inundated with phone calls and TV commercials and pieces in the mail. And at the end of the day, you just might not know who to trust to make an educated decision. And so we're going to go through all things Medicare. We're going to go through the basics of Medicare. We're going to go through Part A, Part B, Part C, Part D, Plan F, Plan G, Plan N. There's all these letters. What do they mean? What do they mean to you to help, again, you make an educated decision when you start Medicare? And for those of you who are maybe not starting Medicare, maybe you have group health insurance, this is still going to be valuable information, and you'll learn the things that you can do to avoid penalties later on. So the other thing is, a lot of people don't know how to enroll in Medicare. Do I call Social Security? Do I call Medicare? Do I have to go down to the Social Security office? Do I need to mail something in? What's the easiest way to do all this? And we're going to cover that. Then avoiding penalties. So the reason why I put this emoji here is because unfortunately not everyone worked with myself or my company whenever they started Medicare. And so there are informed Medicare brokers, and then there are not so informed Medicare brokers. And unfortunately, I can't stop them. Unfortunately, I've seen people that have signed up with someone else, and now they have lifetime penalties, and this is easily avoided. It's not so much supplement plan this, advantage plan that, prescription drug plan this. This is easily the biggest pain point. And then there's a certain way to do this. There's a right and a wrong way to do this. So make sure you're staying and watching this so that you don't have lifetime penalties from doing Medicare wrong. And then the other one is the big boxing match, so to speak, Medicare Advantage versus Medicare Supplement. A lot of people think that Medicare Advantage plans are scams. How can it be free? But we'll cover all this tonight. Then there is prescription drug coverage. That's a big one for people. You need to have your medications covered. You may not go to the doctor a lot. You may not go to the hospital a lot or have a lot of surgeries. But one thing is for sure, if you're taking medications every 30 or 90 days, you want to make sure that your medications are covered, and we'll show you exactly how to do that. Then there are some added bonuses again, and we're going to wait till the end to go through those. But I'm pretty excited to go through all this. Some people say that Medicare is boring, but it's something that I love to do, and it's something that I love to educate people on. So at the end of the day, you just want to make an informed decision. You don't want to have to guess, should I do this? Should I do that? Do I Google this? Do I Google that? Do I call the Social Security office or not? And that's what I mentioned earlier. You're getting all these phone calls. You're getting all these confusing mail pieces. You're seeing all these TV commercials about free this and OTC this and gym membership that. And at the end of the day, you just want the facts. You just want the facts to make an informed decision. So I'm going to give you all those facts and none of the nonsense. So go ahead and grab your pen and paper and take notes, because this is very, very important information. Now, the nice thing about being able to work with us is, just like this webinar, there's no cost for our help. There's a button down below, and if you'd like to, you can actually schedule an appointment with myself or someone in my office, and we can go through all of your options, and you can look at every single plan, whether it's a supplement, advantage, prescription drug coverage, dental, vision, and hearing, all these different coverages we offer, and we make our recommendations all at no cost to you. We actually represent all the different cares, and if you're just looking for someone that can basically just do it all for you and give you all your options that you have and make recommendations, then at the end of the day, you can make an informed decision, and you won't have to go on Google, and you don't have to go to Medicare.gov and all these places. Our recommendations and advice is free, as well as we promise lifetime customer service and lifetime satisfaction. Sometimes the plan that is right for you this year isn't the right plan for you a year from now or 3 years from now. We want to make sure that you are happy year after year. We'll happily review your plan to make sure
So
that
let's
that
talk
happens.
about the exciting stuff. Enrolling into Medicare.
If you are currently on Social Security, some people retire at 62. Some people have a disability. Some people just took Social Security at 64 and maybe were working a part-time job. If you're already on Social Security, you will be automatically enrolled into Medicare when you are eligible. So if you're getting a Social Security check, you're going to be automatically enrolled into Medicare. Now, if you're not taking Social Security and maybe you were working and you plan to retire at 65 and then take Social Security at your full retirement age, the best and easiest way that we found to do this is to go online at ssa.gov. Now, if you're going to call Medicare to enroll, they're going to tell you to call Social Security because Social Security at the end of the day is actually who regulates Medicare. And if you call Social Security, more than likely you're going to have to wait 45 minutes, maybe 2 hours to actually talk to someone, or you can go down to the Social Security office, but we all know how that can go. You might sit in line for a couple of hours. So the easiest way that we have found for you to enroll in Medicare is to go to ssa.gov. And if you're like, hey, I'm not very tech savvy, I need someone to help me with this, we can actually do that for you if you book an appointment with us, again, at no cost. Everything we do, there's no cost for anything that we do. Full transparency, we do get paid by the insurance company, but we get paid the same across all of them. So if you're like, hey, are they biased? No, we get paid just to help you along the process, whichever insurance company you decide to go with, whether it's supplement, advantage plan, more or less, we get paid the same to help you. And that's what's most important to us is that we keep you happy, not only today, but year after year. Now, I want to tell you guys a story about how I got into Medicare. 21 years ago, I was working as a struggling assistant golf pro, just squeaking out a living. And, honestly, I was wondering what I was going to do with my life as I've seen my friends younger than me get married, have kids, and really enjoying their family. And now my dad, I think he was getting a little anxious as well. And he suggested that I get my insurance license. Well, that didn't take me too long. And after a few months, in 2005, I was hired to work for a Fortune 500 company that specialized in the Medicare space. In 2011, it was a tough decision, but I decided to leave that job and open up my own independent Medicare-focused insurance shop. Along that journey, I met my wife, and now I have two beautiful teenage daughters. So yes, as you can imagine, I do face many challenges outside of running my own insurance agency, and I love every moment and every adventure that I'm blessed with. Now, what I love about my insurance agency is the ability to help people choose their Medicare plan, whether it's Medicare Advantage, Medicare Supplement, making sure all their prescriptions are covered, doctors are in network, major holes in some of these plans are covered, or even just helping them enroll in Medicare. I get to do all this and I don't charge a dime. And not only that, I get to build relationships, make friends, and keep in touch with my clients year after year. So now that we've talked a little bit about Medicare, how to enroll in Medicare, a little bit about myself and my agency, let's dive into the ABCs and Ds of Medicare. Let's get down to the nitty gritty and explore what Medicare covers and what Medicare doesn't cover, and the solutions that we provide to cover up the holes in Medicare. With Original Medicare Part A and B, that is what you'll actually see on your Medicare cards. Maybe you've already gotten your Medicare card in the mail. Maybe you haven't quite gotten it yet, but when you do get it, you'll see a Part A and a Part B. And Part A is your hospital coverage, your skilled nursing, your hospice, and home health care. I will say this though, and we do have another video on this topic. Your home health care and skilled nursing care is the hidden gap in Medicare. Your coverage here is so very limited and it's a huge exposure. This is something that really needs to be addressed if you want to protect your hard-earned assets. But back to Part A, If you go to the hospital and let's say you're in the hospital for 5 days, that will be billed under your Part A. And then Part B, this is your doctor's coverage. It's your specialist, your cardiologist, your podiatrist, things like that. So just so you know, this is how original Medicare is set up. Part A will cover your hospital coverage, things that happen inpatient. And then Part B is your doctor, so things that happen outside the hospital, lab tests, things of that nature. So now that we have established what Part A and what Part B covers, what about C and D? Well, Part C is actually Medicare Advantage. A lot of people won't tell you that Part C is Medicare Advantage, but what it actually does is it takes all the components of Medicare, so your Medicare Part A, B, and D, and puts them into one plan. Now, we help people in a multitude of ways. I'm just going to go over the parts of Medicare. So then there's Part D. I always say D is for drugs. This is actually for your prescriptions. So anything that is administered at the pharmacy is covered under your Part D. So with the off chance that you get your prescriptions at your doctor's office, like an infusion, injections, or Part B chemotherapy drugs, something like that, that is actually covered under your Part B. Again, if it's at the doctor's office, but if it's at the pharmacy, it's 99% of the time will fall under your Part D of Medicare. Now let's talk about some of the costs with everything. Part A, there is a $0 premium as long as you have worked 40 quarters in the US. And then your Part B is $185. If you're already taking your Social Security income, then that $185 a month will be deducted from Social Security check. If not, you will be billed quarterly. So let's just say you're working and maybe you're not taking your Social Security income yet. That will be billed quarterly and you'll get that in the mail. But you can actually get set up on Medicare Easy Pay to have that deducted from your checking account. And that is something that we can actually help you do. So what happens if you have Medicare only? Well, one big thing to look at here is 80/20 coinsurance. So what that means is if you have 80/20 coinsurance and you have a bill of $100,000, you are liable for 20% of that. Medicare will cover 80%, but again, you are liable for 20%. And this can be a huge deal for people. So if you're currently working and you have employer insurance, or maybe you're on a marketplace plan, you have what's called a maximum out of pocket. This is different with Medicare. With Medicare, you have no maximum out of pocket. So again, it's 80/20. If that's intact and you get a $100,000 bill or $1 million bill or whatever it might be, you're again liable for 20% with no cap or ceiling. And this is where people get scared with Medicare. This is where people think, am I going to lose my house? And unfortunately, we do see that. We have had people that have come to our office that have had to refinance their house because they just had original Medicare and they couldn't cover that 20%. So with Part A, you have a deductible of $1,676 in 2025, and that is a per 60-day benefit period. To make this easier, let's just say it's about $1,700. So if you're in the hospital in January, you would pay $1,700. And then if you go back, let's say in April, that's another $1,700. And you go back again in July, that's another $1,700. And you go back in December, that's another $1,700. So looking back again at what original Medicare does, there's no cap, there's no ceiling, and it's 80/20. And a lot of people are thinking, well, what are my options? How do I fill this gap? And there's really two ways you can do this. That would be with a Medicare supplement, and you have A and B, and then a supplement plan to pick up where Medicare leaves off, and then you add a prescription drug plan, or you can do that with a Medicare Advantage plan. I want you to think of this in two ways. Keep in mind, you can only have one option. So on one side of the fence, you have Medicare and a supplement and a prescription drug plan. And then on the other side of the fence, you have a Medicare Advantage plan where you've assigned your Medicare rights over to Medicare Advantage company. And again, they are responsible for paying your claims, not Medicare. So again, you can't have both. You have to choose what side of the fence you're on, whether it's Medicare and supplement or a Medicare Advantage plan. A lot of people think you can have both, but you can't. You need to choose one. Another thing to keep in mind when you're in your open enrollment period for Medicare and a supplement, you only have one shot to get this with no health questions. So it is a really important decision. Some people may think, hey, I'm going to choose Medicare Advantage, and then I'm going to go to a Medicare supplement down the road. What we find out is if that's the option that you're looking at, when you want to choose a Medicare supplement plan in the future, you may not be able to qualify because of your current health conditions. When you're in your open enrollment with Medicare and a supplement, there are no health questions to worry about. We'll get into the pros and cons between Medicare supplement and Medicare Advantage plan later, but it is always recommended that you choose one option. There's a lot of different Medicare supplements with different letters, and we're going to focus on the two most comprehensive and the two that probably 99% of people starting on Medicare pick, and that would be Plan G or Plan N. With Plan G, as you can see, it covers the Medicare Part B coinsurance. And if we go back a couple slides, the Medicare Part B coinsurance is 80/20. Well, guess what? Plan G covers this at 100%, and it's about as good as it gets. The only thing it does not cover is the Part B deductible. So in theory, if we play this out in real life, you get Medicare and you get a Medicare supplement Plan G. For this example, it will cover everything besides the Part B deductible of $257. So you can go to the hospital, God forbid you had cancer, congestive heart failure, all these different things. The only thing that you would pay out of pocket, again, is your Part B deductible. It's about as comprehensive as it gets. A lot of people might be thinking, what about Plan F that my mom had, or Plan F that my dad or my friend has? Well, as of January 1st of 2020, that plan is no longer offered, and that's why it's not on the list here. But for some reason, your Medicare started before that, you can actually get a Plan F as long as you can pass underwriting or have a valid enrollment. The other one is Plan N. Plan N is a more budget-friendly plan. You can see it's very similar to Plan G, except it has some small copays of no more than a $20 copay to any doctor that you see, a $50 emergency room copay. And then there's one other thing that Plan N does not cover that Plan G does, and that is the Part B excess charge. If for any reason your provider does not accept Medicare assignment, they could charge you 15% more. Plan G picks that up. Plan N does not. It's pretty rare that that could happen, but we need to let you know that it could. Both are really good plans. If you want the most comprehensive plan, then Plan G would be the way to go. But if you're looking for a more budget-friendly plan, then Plan N might be the plan that you lean towards. You may be wondering what a Plan G or a Plan N costs. That varies greatly, not only by state, but also zip code. We recommend sticking with an A-rated carrier. We really don't recommend a B or B plus company. We like sticking with our A-rated carriers. Also, we have the software to research your particular state and zip code. We do this all at no cost to you. We can research rates and carriers to find your Plan G or Plan N, and in most cases, the lowest on the market, unless of course it's a B-rated company, which we just don't recommend. There are a number of factors also in determining your rates. Are you single? Do you live with someone? Would you be on the same plan with your spouse? Would you pay monthly or annually? Heck, one company even offers a 5% discount if you wear an Apple Watch or Fitbit or some other type of wearable device. Again, we have the software and we can find all these companies to you all at no cost. So let's take a general overview on the Medicare supplement side and break down a few things for you. All these plans are standardized. So what does that mean? If we go back to Plan G and say we look at the rates with Company A versus Company B, the only thing that is different is the price. So Plan G is Plan G and Plan N is Plan N. The coverage is exactly the same. The only difference is what you actually pay to that insurance company. So even though the coverage is the same, which it is, the cost of providing coverage is not the same. Some companies pay a lot of money to advertise. Because of this, they may need to charge more versus a smaller company that doesn't spend heavily on advertising and instead uses brokers like myself to help facilitate enrollment. Some companies have giant buildings and expensive real estate, and some companies work on thinner profit margins. These are all just some of the reasons you see different rates for the exact same plan. No networks. If you travel a lot, let's say you have kids in college and you go to visit them a lot, or you're a snowbird, you've got a couple of houses in different states, having Medicare as your primary insurance and a Medicare supplement provides you with the most amount of flexibility. You never need to ask your provider if they accept your Medicare Supplement X or Medicare Supplement Y. As long as your provider accepts Original Medicare, you're good to go. Now, there are also no referrals to specialists. So if you just want to go straight away to a specialist, you don't need to rely on a referral from your primary care physician. If you want to go see your cardiologist to get your heart checked or an orthopedic surgeon to get your shoulder checked, you have the ability to do this with no referral needed. It's also very uncommon that you would need any type of prior authorization. If it's determined that you need a medically necessary surgery, it's very uncommon that you would need any sort of prior authorization. Now, dental, vision, and hearing would be a separate plan. Your prescription drug coverage would be separate as well. A supplement, though, would be considered the Cadillac of coverages, but it does cost money. That's why it's important to speak to someone like myself that understands all your needs, your budget, and all the different options you have available to you. Someone that can search all the different companies nationwide and know which plan might be the best fit, or when it comes down to your prescription drugs, which plan is going to be the most cost effective and cover all of your prescriptions. Again, we do this all at no cost for people that we work with. We sit down and we make a recommendation after we get all the necessary information from you so we can make a proper recommendation. When looking at Medicare Advantage, there are a number of plans to look at. And because of compliance, I can't go into detail on this webinar on the exact benefits. So let's stick to the basics. So with Medicare Advantage, it will combine your A, B, and D in most cases. Generally, there is a $0 monthly premium. In some places, they do charge a premium, but generally, there is a $0 monthly premium. And now we have plans in some areas that will actually reduce or rebate a portion of your Part B monthly premium. These are called Part B give back plans. And in fact, I have my mom on one of these give back plans, along with an umbrella package to pick up or reimburse her for some of the bigger copays or exposures that you have with these Medicare Advantage plans, like the hospital and skilled nursing copays. You will have a copay or co-insurance for every single service that you have. It might be $0 or $10 for a primary care doctor, or $40 or $50 for your specialist. You might pay $500 a day for the first 5 days if you're admitted to the hospital. What's different about these Medicare Advantage plans versus Original Medicare is that there is a maximum out of pocket. So you can pay $0 for an Advantage plan and still be protected if something happened. Just know you will pay for each service you have up to your maximum out of pocket. These plans are more of a pay-as-you-go type of a plan. Now, the good news is we have these hospital gap plans like the one I have my mom on to fill in or reimburse you for the big hospital copays or the skilled nursing copays. And generally, they are really affordable. The nice thing about these hospital gap plans is generally their prices are set and don't increase over the years like a supplement premium will. These plans are network driven, so that means if your doctor or provider is not in network, you are either going to have to pay something like an out of network coinsurance of, say, 40%, or you aren't even going to be able to use them at all unless it's an emergency. So you got to make sure that your doctors are in network. If you are interested in Medicare Advantage, research your plan to make sure that your providers are in network. Again, we do all this. You get your expert advice at no cost to you. Now, these plans do offer extras like dental, vision, hearing, silver sneakers, over-the-counter discounts. These are probably the plans that you are seeing on TV and getting all these phone calls from. These plans are run by private insurance companies. And when you enroll in one of these plans, you are now on their network. So as I mentioned earlier, there's a lot of compliance around these Medicare Advantage plans. Therefore, I wasn't able to go into specific plans. And honestly, it would probably be misleading because every single county has a different plan, unlike a Medicare supplement, which plans are standardized across the board according to the letter of the plan. Each Medicare Advantage plan has a different set of benefits according to their county. So if you are interested in Medicare Advantage, it really boils down to booking an appointment below with myself or one of my expert licensed agents that really understands a Medicare supplement versus Medicare Advantage, someone who can weigh the options of Advantage plans or finding supplements with the best rates and plans that cover your prescriptions, finding plans that work best with your doctors, have the lowest copays, maybe even covers dental, vision, or hearing, and also educating you on the gaps in the enrollment process that can lead to some of those pesky penalties that I spoke about earlier. So now let's take a look at what Medicare does not cover. This right here is what I call a hidden gap in Medicare. The gap in Medicare that could cost you thousands, even hundreds of thousands. Unfortunately, most agents aren't talking about this. A lot of people are under the misconception, or they just weren't educated on this, and they think that Medicare covers your long-term care and short-term care, and it does not. This is really a huge exposure. I am just putting the finishing touches on a shorter video about the hidden Medicare gap, the gap in Medicare that could cost you thousands. Just know that we do have alternative solutions to protect your hard-earned assets that can be extremely affordable. And just as soon as we're done with this video, we'll get this out to you because I do think it is really important that you watch this. Now, Medicare does not cover dental, vision, or hearing. Just know that if you're looking for a Medicare supplement or looking for additional coverages for your teeth, eyes, and ears, we have specific plans for these. Now, for the added bonus, for those of you that book with me today, I will be sending you a direct link to my digital flip book of Medicare breakdown. But also, when you're working with our office, again, I want to preface this. None of this costs you any money. Again, we get paid by the insurance company, and we will help you enroll into Medicare, whether it's on ssa.gov, whether it's telling you where to go. We will walk you through the steps with your Medicare enrollment. Now, there are certain security measures that we need to take. We wouldn't want to know your ssa.gov or medicare.gov login in order to protect you, but we can show you the path to enrolling in Medicare and walk you through that. You will get our personalized recommendation down to your specific zip code, your doctor, your needs and wants and goals. With Medicare, yes, there are numbers and budgets we need to look at, but some of this is, what are your goals? Do you want to travel? Do you want to see the kids or grandkids? How active do you want to be? So keep this in mind. Say you enroll in an HMO Advantage plan in California and you want to travel to Texas or wherever your kids or grandkids are, you are only going to be covered in an emergency. So if you want to see the doctor or someone that's not in network and it's not an emergency, you have no coverage. Now, this doesn't mean a Medicare supplement or Medicare Advantage plan is right. It just comes down to your own personal wants and needs. And these are all things that we will very carefully consider. Again, we offer this at no cost to you. Your Medicare breakdown book, again, we will get you your digital copy. It's really kind of cool. It's one of those flip books, and maybe you read it, maybe you don't, but it's still a little gift that we like to give to people who choose to work with us. Lifetime claim support. It's one thing to enroll in a plan. It's one thing to have someone enroll you in a plan and they tell you this plan is the best. This is the best that you can get. But it's another thing when you have a claims problem or billing problem. And that's where we come in and can really help. It's not just me. I have a team that will help you whenever problems come up. We treat you like family and really look out for you, not only today, but year after year. And to kind of piggyback off of that, we do offer lifetime annual reviews. You see, what you enroll in today might not be in your best interest a year from now or 5 years from now. So for every client, every single client that chooses to work with us, we offer free lifetime annual reviews. This is just as important as when you first start Medicare to enroll in time and avoid penalties, or enrolling in a Medicare supplement during your open enrollment to avoid health questions. You may get a new prescription, your health may change, you may get a new doctor, whatever the case may be. We are here to make certain that you are covered and covered on the right plan year after year. So do me a favor and, book your appointment below. I know I talk a lot about it, but we will guide you through this process at no cost to you. You get our personalized recommendation. We have the software in place. We have the team in place. We have the experience. We have all the tools in place to help you make an educated decision. So look here, I may be a little biased. I am a business owner. I have a team. Everyone says that their customer service is the best. I'm just going to read you a few of my Google reviews so you can hear what others are saying about me and my team. Most of them are at the bottom of my website. Brian was extremely kind. He explained to me so I could understand my coverage. He looked up my information about my oxygen. Brian was great. So appreciative of Brian's kindness. Brian Penner is #1 for Medicare supplement plans. Brilliant, efficient, extremely knowledgeable of the industry. And here's a review of one of my lead agents, Karime. Karime compared options and was open about these options. She is kind and willing to try to find the best plan for me. Nothing speaks louder than what our clients say. You can read all about our reviews at brianscottinsurance.com. That's pretty much the end of my webinar. And I can't tell you how much it means to me to be able to work with you. And we really want to guide you. We really want to help you make the right decision. So we look forward to helping you. Just book your appointment and we'll be in touch. Have a great day.